Hello and welcome to the Probe Dental Podcast. Today we're joined by Glen Taylor, Chief Operating Officer for the East of England Mobile Dental Units at Community Dental Services CIC, along with the Strategic Mobile Lead, Nicola Blake. Nicola, Glen, thank you for joining us. How are you both today?
Thank you. Very well, thank you.
Good, thank you.
Excellent. So I wanted to jump straight in and ask for an overview of clinical dental services, obviously better known as CDS. I was wondering if you could give us an overview of the social enterprise, how it's a 100% owned community interest company, and sort of what that means.
So as you said, we are a social enterprise. We're 100% employee owned. We're a leading provider of community and paediatric dental care. I look after our East of England region, but we also cover the Midlands. Most of our patients would have a complexity or an additional need: neurodiversity, learning disability, severe autism, mental health issues. It will be patients who can't be treated traditionally in a high street practice for whatever reason. We also outreach to vulnerable groups such as homeless groups. We look after anxious children, children that couldn't have treatment in practice, children with multiple carious cavities who couldn't tolerate normal extractions, who might need sedation or general anaesthetic to help them with their treatment. And as you said, we are a social enterprise. We spun out of the NHS in 2011 under the right to provide. I think social enterprise is a great model. We are an independent provider of NHS services. We're a not-for-profit organisation, so when we do have a surplus, it goes back into training our team or providing wonderful mobile units like we've got here. As I said, being employee-owned is very important to us. As I said, it means we can reinvest into our patients and our teams, and we're dentally led. The majority of our board are GC registrants. We have employee directors on our board, as well as non-executive and executive directors.
Brilliant. So I was wondering if you could tell us about the mobile fleet a little more. I believe you have 8 mobile dental units currently?
So yeah, at the moment we have 8 in our possession. We're looking at expanding that further and modernising, like Glen said, with the social enterprise bit. We're reinvesting to make sure we can get newer, more efficient mobile units. So we've had them for many years. So even pre-social enterprise, we had services for mobile units, but since expanding into social enterprise, we've expanded that service, and we can then take it out to the population that are most in need, and it benefits them because then they get better access.
Excellent. And sort of that investment as well, I believe some of your sort of newer vans are sort of green as well. Is that right? Like, sort of, Is that something they're electric?
Yeah.
Or?
That's right. So we couldn't go fully electric because they're lorries. So because they're 7.5 ton vehicles, they can't go fully electric. And the miles that we do, it'd be good if we were just keeping local, but we do some days where we're traveling like 150 miles each way. So doing that for electric wouldn't be the most beneficial. Stopping off on the services halfway round. But yeah, so we've got 2 of them that are very modern. They're green in the respect of that they've got solar panels. So we're running on the electric from those solar panels during the day. So a clinical activity isn't using the generator, so it's not getting those exhaust fumes. And then also running on HVO fuel, so it's the biofuel rather than the generic diesel. So that's working quite efficient as well.
Excellent. So what does Community Dental Services do with the mobile units? What exactly are they for? Who are they for, and where do you take them? I know you've covered this a little bit already, but
So as you can see, we have a fully equipped dental surgery with a decontamination area, decontamination suite. We have in this surgery we have a chair which is portable; it can move to the side. We have a wheelchair lift the other side of us, where if we have a wheelchair patient, they can get access, come straight into the surgery to be treated. We treat lots of different patients who have lots of different additional needs. As we said, some could have mental health issues. We treat patients in secure settings, children's secure settings. We treat homeless people. We're looking after patients who have vulnerabilities and complexities in their lives, which could make it difficult for them to access dentistry in the usual way. So with a mobile unit, we can take the care to them, which makes life much easier and much more easy to access those vital dental services.
And we've got the sort of expansion, being a social enterprise and not being part of the NHS, we can then look at business opportunities as well. So what we have done is we've helped support the Commonwealth Games when that was in Birmingham. So they had 4 of our trucks going up to Birmingham, up and down the M1, M6, which was great, as you can imagine. That we've supported them the way you can go there, and we've got corporate companies that then look at the health and well-being for their workforce. So they want to look after their health, that they then commission us to come in, and again that funds that we get will generate back into modernising all equipment and the services and the staff.
I was going to ask a bit about, some of the benefits of the mobile units, which are, you've already covered, rather well. If there are any other benefits you'd like to explain, that would be great. But also just, you've mentioned obviously a couple of benefits there of being sort of independent and community led. Is there any more sort of benefits that perhaps aren't so apparent from the outside?
Yeah, I think from our perspective, it's quite nice in the respect that, as you can imagine, we're a fully equipped surgery, like Glen said, on wheels. We can travel wherever. So, one day we can be in a SEND school, the next we could be just in a general car park in a community setting, seeing vulnerable groups. And I think that's the benefit that we get from every patient that we see, is always the fact of, it's not like having to go into a high street dentist where you're sitting in a waiting room, especially some of our vulnerable groups. They said they feel judged, they feel questioned, because you might be in somewhere that also does private care, that they don't look the sparkly Hollywood smile, that they feel vulnerable in that setting. They say they feel at home here because it's very much just a small environment. So we've got a small waiting room that they can sit together, but actually it's just that population we're seeing. We're not mixing patients here and there. So it's getting access where they wouldn't get access normally, and we've got the sort of fortunate aspect of that we can take it to them, but also we don't have the scope of like a practice where they are funded on just UDA, that they have to say, well, if you don't attend 2 appointments you can't be seen again. We're that bit more flexible by saying, well, actually we know their lifestyles are quite sporadic. Dental definitely comes down at the bottom. If you've got a child that's at a SEND school, dental comes down the bottom because they've got lots of medical complications that families just find it hard. So I think the benefit is always going to be that we can take it to them, and it's less invasive for them and less time out of work, school, etc.
In particular, as Nicola mentioned, the special educational needs schools, they find the service invaluable because we're taking a surgery to the school. The school is the child's safe space. Taking a child with such special needs out of a school, it changes their day, and it can be very chaotic for them and very upsetting. So if we're there and they get used to us being there, it makes all life much easier for the parents and for the patient.
That's absolutely fantastic. And obviously you can see how it is such a beneficial service that you're providing. In terms of the green units as well, what kind of differences and benefits have you seen versus the older dental units? And is that something you're going to continue kind of investing in?
Absolutely. So I think that's the way forward, is making sure. So every single one that we have designed or we've purchased, we make sure that they're fully accessible for wheelchair users and the general population. So I think the green for us, and it's going to sound something really strange, the green for us is the peace and quiet, because as you can imagine, if you've got a generator running all day, even though we've got it insulated, it can still be quite noisy. And sometimes they get a bit clunky, so then patients think, oh, what's that noise? And it's just a generator. But it's quite peaceful now. I know that sounds strange.
Yeah, such as now we're sitting here in the mobile and we haven't got a generator running. You haven't got that diesel in the background. It's brilliant. Yeah. They're really, really good.
That's fantastic. What does the future hold? Obviously, we're at the start of a new year. What does the future hold for community dental service and for your mobile units?
For the mobiles, I think it's the plan of looking ahead. So we're always thinking, we're always linking, Glen and I, of where we can go next and what's the next sort of area. We're looking at how can we expand that service and looking at, okay, if we've got some older units that we need to then decommission, do we look at exactly the same mix that we've got now, or do we look at another mix? So I think we're looking, do we need a smaller unit that we can just take for screening aspects and sort of preventative care rather than the big full surgery? It would still have a surgery in it, but just slightly different. That it's looking at that, how do we evolve? And then if we get a smaller unit, then you could look at your electric, so fully electric engines as well. So I think it's always what what can we do better and how can we improve the services that we're delivering to patients.
And one of the ideas we've had is a support unit, because the unit we're in now, being very green, it has a waiting area behind us, but we couldn't turn up at a field or a car park because there are no toilet facilities for us or for the patients. So we might look at a support unit that could have additional facilities, additional waiting area. That's another idea that we're researching at the moment.
Oh, cool. So would that be sort of separate vehicle that follows you down the motorway, essentially? And
yes, if we had to provide services from an area which was usually we provide services from a site where they would have some toilet facilities or facilities for our patients as well. But if that didn't, we'd be looking at a different way of working.
That sounds like a good plan. Okay, just finally as well, I understand organisations can hire your mobile units. With that in mind, I was wondering what services are offered and to whom and where you will travel. I mean, how far will you go?
Oh, is that Nicola answer that one?
I knew he was going to turn to me on that. So what we do is have everybody contact myself and I coordinate all of that. We sort of do it within a sort of 2.5 hour radius of here where we're based in Bedfordshire, dependent on obviously the contracts. And then we do it because the driver can do it. So there's various options that you can hire just the van. So they say a surgery is being renovated. A dental practice can hire the van for a 3-month period while they're having the renovations done, so they don't have to down tools fully. So they can hire the van and we just park it there for them and we arrange that they have facilities, etc. And then you've got we can hire the driver bringing the van back and forth. So a dental practice can run also a remote service if they wanted to. And then you've also got that they can hire the dental van with the driver and the dental team. And we do it on a commission basis where then it might be the organisation funds for their individuals to be treated for examinations. So there's various options for us and people to investigate. And all I say is any question isn't a strange question. Always ask it and I can say yes or no and give them guidance on that as well with regard to the mobiles.
And we work with ICBs, we work with local authorities, we work with charitable organisations. We've been doing some charitable work in Norfolk recently. If a mobile is needed somewhere and we could evidence its need, we would try and do that.
Fantastic. Is there anywhere that anyone watching, listening can find out more? I take it the CDS website, perhaps?
Yes. So there's CDS website, and then on there'll be a mobile services email account as well that comes to myself. So if they have any queries that they want to know, they can email that and then we'll pick that up and go back to them.
Brilliant. Well, we'll make sure to try and include that in the episode description as well. So everybody can just go down and take a look. But brilliant. Thank you for joining us today. It's been an absolute pleasure and I really appreciate your time.
You're very welcome. Thank you for inviting us.